Throughout history, people have used tattoos. Egyptians used them to symbolize fertility and nobility. Piercings had a religious impact on Mayan culture, while Romans used them to signify their manhood. In the late 1800s, European royalties had tattoos as a fashion statement. Since then, the respect for tattoos and body piercings has decreased, yet as we move into the future, it has become more acceptable, and most of you probably either know somebody with earrings or a tattoo or a combination of both. If not, you know me, so I have a combination of both. So we now know somebody with a tattoo and multiple piercings. One of the common things is perceptions. Everybody knows Jack Sparrow from the Pirates of the Caribbean. Pirates are usually one of the stereotypes for piercings, tattoos, and vulgar language, pretty much. But I figured this quote is pretty close to perceptions. The problem is not the problem is your attitude about the problem. Most people think that when people have tattoos and piercings, that they're going to be rebellious, delinquent, have multiple problems. However, a story in 1985, Henry Ferguson was in a very bad motorcycle accident. He had severe internal injuries, and because of all of his multiple body piercings, this emergency room staff was more focused on removing the piercings than actually getting him the help he needed. He would have died if the surgeon had not stepped in and told him to go ahead and save his life. Most people think it's acceptable for women to only have one ear piercing, while men have none. And then tattoos are more acceptable on men than on women. Some of the sayings on people that do not like tattoos or body piercings is, I'm offended when I'm forced to stand in close proximity to people that are tattooed, such as at checkout lines, waiting rooms, and elevators. And when I see a tattoo on a beautiful woman, I immediately have a negative impression. If I was not in a business, I would not hire a person with a tattoo. So piercings. One of the most common things is suicide disease, which happens on the tongue. Basically, it is defined by excruciating pain in the face and neck. Usually only 1 or about 15,000 people get it, but it's still caused by the nerve that's in the tongue that's connected to the jaw that magnifies pain. And the risks for a pierced tongue, you can crack and chip your teeth by chomping on your stud. Allergic reactions to the metal. Choking, you can swallow the bead or the ring that's in your tongue. You can get keloids, which is basically excess scar tissue from the piercings, and infection. You can actually get hepatitis from the needles used in piercings. This is a tongue infection, and then what happens when you don't take care of gauges. The top one there is a keloid. We've got the chipped teeth from tongue piercing, and then infection from cartilage. This woman actually almost lost her ear due to this infection. Within a couple of days of getting her cartilage pierced, it started hurting. She went back to the piercer. They changed out the stud. Within 2 weeks, it was swollen, purple, and oozing pus, and they had to end up going in surgically and had to almost they ended up removing part of her ear and having to reconstruct it. Tattoos, well, first off, they're permanent and very difficult to remove. Usually takes different lasers if you have different colors, so each trip is going to be a different laser depending on how many colors you have. They're very expensive. Each treatment is $500 to $1,000. If you spend only like $60 on the tattoo, it's going to be a lot more expensive to remove it. You might as well just cover it up. And because of the removal, you have the possibility of scarring. And most often than not, to completely remove a tattoo, you're going to end up with scarring in the process. Risks, you get infections mainly by needles again, and unclean environments, allergic reactions to the dyes. Some people have had very bad allergic reactions to certain dyes. Granulomas is kind of like the keloids. It's excess scar tissue, and that pretty much, it forms around the different pigments and the abnormalities in your body. Think it's not supposed to be there, so it builds up and you get this really nasty growth and all. And most common is dissatisfaction. Tattoos sometimes fade, and depending if it's not done right, sometimes the ink can be injected too deep into your skin, which causes it to pretty much spread further out than the precise line that you may have wanted, which creates blurry images. So this is what I talked about with the granulomas. This was a heart. You can still kind of see it, but within I think it was 3 months of getting this, the woman noticed that she was getting bumps on her tattoo, and it's actually caused by the red dye that was used on the inside of the black outline of the heart. But within under a year, she had to have it removed and has a 4-centimeter scar on the side of her ankle. And this is the process of removing the tattoo. After 5 weeks, you can actually still see that the tattoo is there. Usually takes a minimum of 8 weeks to fully get rid of the tattoo. And also you have the dissatisfaction. Say you got your ex-lover's name tattooed on you. It's gonna be hard to remove it, so you can, like, some people do funny stuff like this. I saw one that had the name with a line through it, and then shit happens underneath of it. And then this, you can just, you can cover it up with various pictures that you want, but you can actually still see that the name is there. If you look close enough, you can still see the shadow of it. On these, they're a little harder because they actually incorporate the line work and the designs in with the new cover-ups. And safety. All of it can be done safely. Go to a professional. Don't do it yourself, especially if you want. If you don't want a high quality, you can. You can actually go online and buy certain equipment and do pretty much a prison tattoo. You're going to have less quality work, but you run the risk of more infections and blurry images that you may not like. You can ask about the cleanliness and infection control. If you don't feel safe or get satisfactory answers, leave. Don't stay in a place. Trust your gut in this, really. Only patronized shops that use an autoclave. An autoclave is pretty much a giant oven that uses pressure and steam to sterilize all of the equipment. And make sure that all the equipment used is new. You don't want to have any ink that has been used previously. You can get hepatitis from used ink and needles. For new piercings, where usually stainless steel or 14 karat gold, for me, I have to use stainless steel because I cannot wear gold. I can only wear stainless steel and sterling silver. That's it. And you have to keep them clean. If you do not clean them on a regular basis, they will get infected, they'll get gross, and you will end up with keloids and may even end up in the emergency room getting jewelry surgically removed. And basically, before you get a tattoo, do your research, because you really don't want to regret anything that happens afterwards.